called Resident Guide. It's an app that we've produced as the education unit that's targeted at the junior doctors, trying to improve their access to all the things that they need on the wards, so they can work efficiently and reduce their stress load, reduce their workload. So we've designed specifically for junior doctors, and we'd heard about it. It's in a number of hospitals in New South Wales, and we're the first hospital to get it in Queensland, which is pretty cool. So we're excited about that, and everyone seems to be liking it so far. For junior doctors, we've produced a number of different things for them, from basic things to maps of the hospital, to introductions to the hospital and the DDHHS, through to things like introductions to their different rotations in the hospitals, just some basics about what they need to know for the term, who their boss is going to be, what they need to know from that point of view. And then if they're in the hospital after hours and they have to respond to a particular thing, like there's a patient with chest pain, it'll give them an intro to how to manage that patient and how to look after them, which can be reducing a bit of stress when you're on your own as a junior doctor in the hospital. It's a bit of guidance and help then and there. It's also got some different parts like a phone book, so they can call anywhere in the hospital just off their phone. Yeah, that's some basics. We're realising more and more that being a junior doctor in a hospital is a very stressful time. So anything we can do to reduce those kind of stresses and focus on how we can help them through that time in their career is very important to us, particularly in the education unit.
Oh, I think the MEN app is great. I talk to lots of other residents around Queensland and no other hospital has it, and they're all looking at starting something like it. So it's something I think that everyone's a little bit jealous of Toowoomba for having. But simply, it cuts down time and it helps people who are learning when you're starting out as an intern, as a resident. You just pull out your phone and the number's there straight away. And I think from a learning perspective, there's specialty guides and there's referral guidelines and consult guidelines which really help you with the hospital, so you know when I'm referring to the stroke registrar or to the infectious diseases registrar exactly what information I have to have in front of me, and that's something that I think is really novel and is really beneficial for a learning doctor, but as well as, you know, someone who's new to the hospital or new to the system in terms of smoothing things over.